Hi, my name is Andy Astrakhan, founder of the AGA Foundation, UNICEF International Council member, champion for everyone's right to safe water, and the initial investor in what is now UNICEF USA's Water for Guinea program, which my charitable foundation piloted in 2014.
Hi, I'm Wendy Serino, a member of UNICEF USA's Water for Guinea family. And personally, I've supported UNICEF for over 20 years because I know they save more children's lives than any other humanitarian organization in the world. This project is very special to me because of how it immediately makes lives better for the people and the villages it serves. We can't wait to tell you more about it. Andy and I would like to welcome you to UNICEF's virtual Guinea field visit.
As yesterday was World Water Day, we are thrilled you have joined us today to see how UNICEF USA's Water for Guinea program is saving lives, serving families, and transforming futures with generous support from the ever-growing Water for Guinea family of donors.
So first, a couple of housekeeping items. Immediately upon joining, you have been muted and your cameras have been turned off. However, we really want to hear from you. So please put any question you have in the Q&A box at the bottom of your screen, and we'll try to get to all your questions later in today's program. Thank you for traveling with us today. Many of you tuning in have personally contributed to this project, and it means so much to us to be able to share this hour with you. I was fortunate to travel to Guinea in person in December of 2019. Little did we all know that this would be our last international trip for a very long time. I'm excited that you get to see this for yourself today. We'll be in rural Guinea to see how UNICEF is providing access to safe water for these communities for the very first time. This immediately changes lives for generations to come. The current pandemic has disrupted education for millions of children around the world. And on today's visit, we'll see how UNICEF is supporting children's education in Guinea throughout this crisis. But before we dive in, Andy, why don't you tell everyone why it is we are heading to this small country in West Africa?
Thanks, Wendy. Hard to believe, but almost 12 years ago, I literally woke up on the morning of my 50th birthday, driven to provide access to safe water in Africa, and lots of it. And that was before I had ever been to Africa, or quite frankly, thought much about water. And it was before I knew that over 785 million people worldwide still lack access to safe water, including 1 in 3 in Guinea. Knowing that I needed a partner to fulfill my vision, I looked closely at all the charities and NGOs who were, one, providing water, as well as the essential components of sanitation and hygiene in Africa, and two, delivering that 360-degree solution at the lowest possible cost and doing it with scalability. I concluded that by far and away, UNICEF was the best positioned. Now, coincidentally, at that time, UNICEF Guinea was looking to pilot a new but simple solution using manual drilling to access the Earth's natural water source. Because manual drilling doesn't require machinery that needs to be transported, it was ideal for a country with poor roads and remote villages.
And you'll see later just how crazy bumpy these roads are.
And because it is extremely cost efficient, less than $5,000 will provide an entire community a borehole with hand pump for generations, I knew my investment in that pilot program could make a big difference. And it did. With 123 wells constructed, 83,000 people reached, more than 300 drilling jobs created, local businesses incubated to manufacture key component parts like the hand pumps, creating even more jobs, and even more people reached through other private funders utilizing our same resources developed by UNICEF for phase 1. The pilot program was an overwhelming success. So UNICEF USA and I decided to leverage this success and expand the program to reach more people, this time incorporating solar power technologies as well. With a budget of $4 million, of which I have committed $1.4 million through my foundation, the second phase of Water for Guinea aims to reach 220,000 additional people. For phase 2, I knew that I couldn't be the only charitable person in the world who understood the incredible value proposition of this investment. And that's when UNICEF USA introduced me to Wendy, who also made a significant investment, and Water for Guinea became a family.
What's so incredible about Water for Guinea and what really differentiates UNICEF is its top-down, bottom-up approach. On the individual village level, community-led water committees are trained by UNICEF so they can monitor and maintain those water systems. And I've personally met some of these committee members, and the pride they take in their systems is really what keeps this project so sustainable, because it's 100% community owned. And UNICEF simultaneously building the structure for scalability, so more people can benefit from the foundation laid through UNICEF's partnerships. Communities, the federal government, and local elected officials, who often are the catalyst for change, can expand access to safe water beyond those who will be reached by Water for Guinea. And what's great is that we already know we've achieved this aim. Next year, the government of Guinea will receive a significant loan from a private bank to focus on water programs, and it was determined that this funding will be dedicated to scaling this program nationally.
We are currently in the third year of this 4-year project, and although COVID-19 disrupted the timing of constructing boreholes, it has not impacted our overall mission, a mission that requires only $450,000 of additional funding, a gap that we hope that you are inspired to close. Now let's virtually buckle up as we travel to Guinea to see the power of what's possible and the impact on children's lives we can make together.
Over to you, Pierre.
Thank you very much, dear Wendy and our colleague Andy. I would like to welcome everybody to this virtual visit to the field in Guinea, especially the water program. We will also show some education program. This is really an exciting day for us because despite the pandemic of the coronavirus, this innovation allows us to still exchange on the work that is being done in Guinea, especially the Water for Guinea program. I would like to welcome you to Guinea. You all know a country in West Africa, a population about 13 million people. Poverty is quite prevalent here. 40% of the households are categorized as poor. Most of the children face serious challenges, whether it's in education, where only 2/3 of children are in primary school, or in health in general. Still, we have very high mortality rate in infancy, 60 per 1,000 infant mortality rate. 1/3 of the children do not survive to the first months of life. That's quite a very high rate of mortality. And also, if you look at access to water, for instance, the areas where the Water for Guinea program is anchored, majority of the population don't have access to clean water. And I think Hamidou, my colleague, is going to talk about that. We have this situation, this dire situation for children. Unfortunately, in 2020, the COVID crisis came, and it was another layer of difficulties that are put on the shoulders of children. The pandemic really disrupted the education system. Schools were closed for a while, but we really work with the Ministry of Education to ensure that children go back to school, not only go back to school, but go back to school in a safe learning environment that protect them from the coronavirus. The pandemic also disrupted health services. We have figures showing that vaccination rates went down. Attendance of health facilities went down because people fear of contracting the virus made them somehow run away from health facilities. But the work of UNICEF and government is especially very strong in those situations by ensuring that there is some resiliency, but ensuring that the population understand that they are better off going to the health facility during the crisis than not going there. So this has really helped a lot. We have, during the crisis, run 2 national campaigns of vitamin A supplementation. We have run a vaccination campaign during the crisis. And the situation of Guinea is very specific, because we are not talking about 1 or 2 or 3 epidemics, but we are really talking about multidemics. We have now Ebola recently that hit the country on top of COVID, but we have also epidemics of yellow fever, of measles, of poliovirus. It is against all these epidemics that the government is struggling, and UNICEF on his side, of course, that we are organizing this field visit, because we still think that in the middle of this crisis, there is another crisis. How can you struggle with coronavirus when you really don't even have access to water, whether in the household or in health facility? That's extremely difficult. How can you struggle? How can children continue learning in school when they don't have sanitation, they don't have access to water in schools? So this is why while we are fighting Ebola, we really wanted to come and talk to you, this generous audience that left everything to come and talk to us. This is very, very important. On this virtual visit, we will travel to Zerekore and Labe. Those are 2 regions in Guinea, to see the Water for Guinea program. Amidou Maiga, our chief of WASH, will guide and speak about the manual drilling program that Andy mentioned earlier. In addition to the exciting innovation approach around using solar energy to power water pumps, bringing safe water to communities. You will also hear about education, our education program, briefly. Our Chief of Education, Ephraim Bahogwere, will speak a little bit on the scholarship we have. The scholarship which covers about 60% of school costs, but which make huge differences, especially in rural areas where many girls, many boys don't go to school because their parents cannot afford it. And a small amount from this scholarship helps millions, millions of children go to school. So those are 2 big elements of our school visit. Let us begin our journey. Hamidou, over to you.
Okay, thank you, Pierre. And thank you, Wendy and Andy, for opening the call for such a great overview of Water for Guinea, and moreover, for your incredible support. My name is Hamidou Maiga, and I have served as Chief of WASH for UNICEF Guinea for over 2 years now. Prior to this post, I worked in the WASH sector in UNICEF country offices such as Haiti, Bangladesh, or Chad. So I have worked in countries where the availability and sustainability of safe water present challenges. I would like to start by providing a fuller picture of what it's like for children living in the remote villages Water for Guinea support, Zerekore and Labe. 75% of households in these regions do not have access to safe drinking water at home. As Pierre mentioned, lack of access to water is severely detrimental to a child health. Indeed, for the aged 6 to 11 months, a child in 4 has diarrhea according to Health and Demographic Survey 2018, a disease related to water quality and water quantity. In Guinea, 75% of primary schools aren't connected to any source of water whatsoever, and more than 20% of health facilities lack any access to this water. This means kids were missing out on education and babies were being delivered in unsanitary conditions. Open defecation is still widely practiced, especially in rural areas where it stands at 21% of households. And now with COVID, Ebola, measles, and polio cases, water is more important than ever. Important to note, Government partnership since beginning is crucial for long-term success to the program. When the initial pilot program launched, Zerekore severely lacked the infrastructure to quickly deliver access to water. So that was the first priority, to identify, professionalize, and train small to medium-sized enterprises so that they can do the work. Next, we needed to identify the most vulnerable villages, those with residents that had to walk the farthest to fetch water and had the highest rate of under 5 mortality. After geomapping the region, we knew the best places matched with those villages with the highest needs. So with those small and medium enterprises, we started delivering safe water and therefore really transforming communities. Because of the contribution from many of you with us today, this phase of Water for Guinea has already reached a total of more than 50,000 people, 57,000, sorry, people. This is through 86 manual drilled boreholes with hand pumps and 5 retrofitted solar powered systems. On top of that, 59 people have been trained to monitor and maintain these systems. Over 320 people are employed through small, medium-sized enterprises, which then support around 2,200 family members. All that economic activities supporting locals. The COVID-19 pandemic did not, in fact, disrupt our timing. The country had a restriction against traveling and on and off lockdown, we've prohibited us from constructing solar-powered water systems last spring. And our team had to prioritize safety and health programming. In total, 20 manual fitted boreholes fitted with simple powered water systems were slated to be completed last year that we had to postpone to this year. Despite those challenges, during the calendar year 2020, Water for Guinea delivered sustainable water sources to over 14,000 people, hence strengthening their defense against these diseases and decreasing the need to travel between villages, perhaps spreading germs unknowingly. When traveling to Zerekore, I met Kumba, a 19-year-old woman who lived in Bolodu. In 2018, when she returned to Bolodu with her 4-month-old child, her integration was very difficult due to the lack of water shortage. She told me, when I arrived here in Bolodu, my first remark was about the lack of drinking water. With my grandmother being old, I had to wake up at 5 a.m. to collect water from a water hole. When I came back, I took at least 30 minutes to filter water before using it. Until 2018, Bolodu has only 1 manual drilled boreholes serving a population of more than 1,300 people. In order to be among the first served, it was necessary to get up earlier, otherwise it was an endless flight. The water shortage also exposed children to many diseases. Kumba told me that her child had experienced a number of health problems due to the unsafe water at the water hole. 1 year later, and what a difference Water for Guinea has made to the communities and Kumba's lives. Between 2019 and 2020, 45 manual boreholes and a solar-powered water system have been constructed in Bolodu. Kumba told me, since this water fountain was installed in my village, you cannot imagine how happy I am. Now my only priority is how to continue my studies and take care of my child. Kumba is just one of the young people whose life have been transformed by Water for Guinea. We would like to show you more our innovative approach to ensuring water systems are not only sustainable, but also climate resilient. Solar-powered water systems promote resilience in the water supply, even during times of droughts. And unlike their diesel-powered counterparts, solar-powered pumps generate no emission and they break down far less often. Now we will travel to Zerekore and Labe to see solar-powered water system in action. You will also hear that the CEO of a private sector company operating in the wash sector. This company has been trained and equipped to manufacture equipment that meet our technical standard for manual drilling. This partnership is also helping to provide employment for local young people. Let's take a look.
Bonjour, je m'appelle Hamidou Maïga, je suis le chef du programme eau, hygiène, assainissement à l'UNICEF en Guinée-Conakry. Nous allons entamer une visite de terrain des programmes eau, hygiène, assainissement et éducation dans les régions de Zérékoré et de Labé. C'est parti, nous sommes là dans la cour de l'UNICEF, nous allons démarrer bientôt et vous vous rendez compte que c'est tôt le matin. Parce que la distance est un peu longue, c'est la raison pour laquelle nous quittons maintenant tôt. C'est parti, on est ensemble. Après 2 jours de voyage, nous voilà arrivés dans la région de Zérékoré, plus précisément à Guékédou, une préfecture située à plus de 650 km de Conakry. Nous voilà dans la commune rurale de Bolodou, où beaucoup d'efforts ont été faits dans le secteur de l'eau, l'hygiène, l'assainissement. Particulièrement grâce à l'appui de USNATCOM. Nous devons dire que dans la commune rurale de Bolodou, sur 86 villages, grâce à l'appui de USNATCOM, 42 de ces villages ont bénéficié de points d'eau. Ceci est vraiment extrêmement important quand on sait que c'est une zone d'accès difficile et où les forages mécaniques, les ateliers mécaniques sont difficiles à creuser. L'atelier mécanique a beaucoup de difficultés à atteindre ces villages. C'est pourquoi la technique de forage manuel est une technologie vraiment adaptée à ce contexte. En plus, sur ce site, nous avons fait un système d'eau solaire. Je vais pouvoir vous guider dans tout le processus pour vous expliquer un peu pourquoi nous avons fait ce système solaire-là, ici à Bolodou, et pourquoi c'est extrêmement important. Le forage à partir duquel nous avons fait ce système d'eau. Vous venez tout à l'heure de voir le forage qui est de l'autre côté. Là, derrière moi, vous avez des panneaux solaires. Il y a 6 panneaux solaires d'une capacité de 1600 watts qui sont connectés à une pompe électrique qui se trouve à l'intérieur du forage. Ce sont ces panneaux-là qui permettent de pomper l'eau à travers cette pompe-là jusque dans le réservoir que vous allez voir tout à l'heure. Ce château d'eau de 10 000 litres permet d'approvisionner 3 bornes fontaines, donc 9 robinets au total, pour une population d'environ 1400 personnes au niveau de la ville de Bolodou. Après ici, merci de me suivre, nous allons visiter une borne fontaine pour que vous puissiez savoir de quoi je parle. L'eau coule du réservoir de 10 000 litres que vous avez vu pour alimenter cette borne fontaine. Une bonne fontaine, cette bonne fontaine est composée de 3 robinets. Vous voyez que 3 femmes peuvent puiser en même temps, sans faire des efforts et vraiment d'une façon très convenable, l'eau coule directement. C'est ça la différence entre le système d'adduction d'eau et le forage manuel. Okay? Et donc, vraiment, nous pensons que la pénibilité des femmes est fortement réduite et c'est beaucoup plus convenable. Nous allons maintenant prendre la route pour nous rendre dans la région de Labé, où nous allons également voir les programmes d'eau, d'assainissement, d'hygiène. Cela nous prendra 2 jours de voyage, 2 jours de route difficile. Mais encore une fois, c'est ça aussi la réalité du terrain, c'est ça qu'il faut pour pouvoir atteindre les enfants de Guinée. Donc, suivez-moi, nous allons partir à Labé. Bonjour, ça va? Ça va bien? Tout va bien? C'est ici? Ah, ok, d'accord. Il y a 3 bonnes fontaines, je vois. C'est ta maman qui est là, n'est-ce pas? Ok, ok. Ok. Ici, nous sommes à Doguel-Signon, une commune rurale de la région de la Baie. Et ici, nous sommes arrêtés devant le système d'eau solaire de la localité de Doguel-Signon. Une localité qui sert plus de 3000 personnes et qui est composée, vous le verrez tout à l'heure, d'un forage, de panneaux solaires, des réservoirs que nous allons voir également et de bornes fontaines, de 7 bornes fontaines précisément.
Nous voilà à la baie où nous allons visiter l'unité de fabrication des pompes manuelles de FAPEL. Ça, c'est l'autre impact du projet, l'impact économique. Avec nos fournisseurs, nous allons voir combien de personnes ont travaillé sur les pompes manuelles, quel est l'impact économique, quels sont les bénéficiaires indirects de ce projet. Suivez-moi au niveau de l'unité de production.
Aujourd'hui, FAPEL, à travers ce projet, a eu à former plusieurs jeunes et surtout à employer, comme vous avez constaté. Donc il est très important qu'on le dise aujourd'hui. L'appui, c'est à travers vraiment ce projet, combien de fois ça va créer de l'emploi.
Merci de nous avoir suivis pour ce périple de Conakry, dans la région de Zérékoré et également dans la région de l'Abbé, où nous avons pu voir les programmes d'eau, d'hygiène, d'assainissement. Merci.
It's incredible to hear the result the program has achieved thus far. Access to safe water is not only critical to children's lives and health, but plays a vital role in the ability to pursue an education. I am Ephraim Bahogwere Matabaro, Chief Education at UNICEF Guinea. Now we are going to travel back to Zérékoré and Labe to see an education program that's helping to provide scholarship to vulnerable children. This program is increasing children's chances to return to school. We will also hear how school adjusted during the pandemic. Let's take a look.
Moi, c'est Dr Claude Ngabou, je suis le chef de bureau de l'UNICEF pour la région de Zérékoré. Pour l'éducation, nous aurons tout à l'heure l'occasion de visiter ce qui est fait en matière d'éducation et nous aurons également la possibilité de rencontrer notre collègue Sassiba Milimono qui est en charge de ce secteur, qui vous expliquera davantage les activités réalisées dans le domaine de l'éducation à Bolodou.
Je suis Sassiba Milmouno, administrateur chargé de l'éducation à l'UNICEF, bureau de zone Zérékoré. Je voudrais vous parler de la bourse scolaire. La bourse scolaire est un programme de protection sociale qui a été initié et qui se met en œuvre par l'UNICEF, dont l'objectif est d'appuyer les enfants issus des familles vulnérables, notons ici des enfants orphelins, des pères ou des mères ou des deux parents, les enfants qui parcourent les longues distances pour se rendre à l'école, les enfants qui manquent de soutien pour aller à l'école. Donc, bref, ce sont là les catégories d'enfants d'abandonner l'école par manque de soutien pour leur scolarisation. Nous allons spécifiquement vous parler de la commune de Bolodou. Au niveau de la commune de Bolodou, un certain nombre d'enfants est soutenu et appuyé par ce programme. Pour le savoir plus, je vous invite à suivre les autorités communales. Venez avec moi. Bonjour, monsieur le général.
Ouais, bonjour, monsieur.
Comment allez-vous?
Oui, ça va. Le problème de bourse, ça n'a pas été tellement peu facile parce qu'on avait eu 80 admis. Et 80 admis, sur 80 admis, il faut prendre 16.
Pouvez-vous nous expliquer comment est-ce que le processus a été conduit jusque-là?
On a mis une commission technique. Et cette commission, il y avait la commune, il y avait les cadres de l'éducation qui ont travaillé sur le dossier pour voir la véracité. Donc là, quand la commission a travaillé, c'est la commission qui a validé les résultats. Donc si ils ont choisi ça, ils sont tenus compte de l'État. Ça, c'était l'éducation, c'était pour encourager quand même la scolarisation des enfants. Parce qu'ils voient qu'il y a un laisser-aller quand les parents n'ont pas les moyens quand même pour payer la fourniture et l'APAE. Donc il fallait les venir en aide pour quand même rehausser le niveau de l'éducation à Bolodou.
Et comme vous le savez, ce sont les enfants vulnérables. Les enfants qui vivent ici en général, les parents n'ont pas de revenus. Donc ces enfants-là vont dans les champs, dans les entraides. Les enfants que nous avons choisis se retrouvent dans ces conditions-là. Aujourd'hui, grâce aux bourses apportées par l'UNICEF, ils ont eu les fournitures au complet, s'il faut dire comme ça. Les principaux nous ont remonté les notes. Ils ont vraiment de bonnes notes. Ils sont les meilleurs élèves aujourd'hui.
Est-ce que vous pouvez nous dire comment est-ce que vous avez géré la fermeture des écoles en termes classes intermédiaires et classes d'examen pendant cette période de Covid-19?
On a suivi une formation pour la réouverture des classes d'examen. Donc avant cela, il y a eu les cours à distance pour ne pas que les élèves chôment. Donc le département a initié des cours à distance à travers les ondes.
Ainsi, nous rendons l'antenne à nos collègues de la baie. Merci beaucoup.
Moi, je suis Hadi Kamara, éducation officielle au bureau UNICEF à la baie. Et je remercie mes collègues des Erekore, notamment Sassiba Milimuno, éducation officielle, pour m'avoir passé le flambeau. Nous sommes à Dongol-Sigon. Dongol-Sigon est l'une des 12 communes de convergence du bureau UNICEF à la baie. Et Dongol-Sigon abrite le projet de protection sociale des enfants vulnérables. Ces enfants qui sont couverts par le projet sont au nombre de 60, dont 45 filles.
Illa Suleiman, professeur de français au collège de Sigon. Et Fatoumata Binta est une élève boursière parmi tant d'autres. Ces enfants avaient assez de difficultés avant l'appui de l'UNICEF, notamment des difficultés financières liées à l'achat de fournitures, disons aux frais de scolarité, à la nourriture. Donc certains enfants venaient sans prendre le petit déjeuner. Donc parfois aussi ils avaient problème de chaussures. Donc il y avait tous ces problèmes à ce niveau. Par exemple, la fille là, elle vit avec sa grand-mère. Ses parents déjà évoluent au Libéria, donc sous l'effet de l'exode rural. Donc ce n'est pas facile, c'est une vieille, disons, personne qui est en train de l'élever. Donc la bourse est venue à point nommé pour vraiment soulager la famille. Et depuis qu'elles ont commencé à bénéficier de cette bourse, maintenant on a senti une grande amélioration du point de vue fréquentation, rendement en classe, les révisions à domicile. Donc elles forment des groupes et elles ont les tenues réglementaires, les fournitures aussi ne manquent pas. Donc tout ça c'est lié à la bourse scolaire. Elles ont quelque chose aussi, elle a souvent aussi un moyen pour acheter quelque chose lors de la récréation.
Bonjour messieurs, je m'appelle Fatoumata Bintaba, je viens de Djoli, j'ai l'âge de 15 ans, je fais la 8e année au collège de Sigon Centre. Je vis avec ma grand-mère paternelle, fille de Mamadou Fadia et de Ramatoullah Issou. Je bénéficie de la bourse scolaire de l'UNICEF. Avant cette bourse, mes parents avaient quelques difficultés pour avoir mes fournitures scolaires et payer mes frais de scolarité. Cette bourse a beaucoup amélioré dans ma vie scolaire, comme ma fourniture scolaire, payer mes frais de scolarité, comme mes habits, mes chaussures. Après mes études, je pense être une doctoresse. C'est pour soigner les malades et aider ma famille.
Sattende, ay fi ñamete, sattende moƴƴano. Joni ɓayru pellet meɗen ñamete no yaltude mum.
La mission de Dongol-Sigon prend fin. Nous saluons vraiment l'engagement de toutes les autorités, des parents, des enfants. Et nous avions compris l'engagement de tous les acteurs autour du projet de protection sociale des enfants, surtout des enfants vulnérables, en particulier des filles. Donc, au revoir, à la prochaine et bon voyage.
Hi, everyone, and thank you again for being here with us today. My name is Missy Sorolla. I'm a Senior Philanthropy Officer for UNICEF USA. I've also had the great honor of supporting Water for Guinea since its inception. Before turning to the Q&A portion of today's virtual field visit, I did want to share that Andy Astrachan and Wendy Serino have kindly offered to connect with anyone offline should they have further questions about their partnership. If this is of interest, please reach out to your UNICEF USA relationship leader and we can coordinate. Now, I'm thrilled to be joined on screen with our UNICEF Guinea colleagues and friends, UNICEF Representative Pierre Niom, Amadou Maega, Chief of WASH for UNICEF Guinea, and Ephraim Guerre, UNICEF Guinea Chief of Education. Thank you all for being here with us today. Now, I'm seeing lots of questions in the Q&A. Please keep these coming. We will do our best to get through as many as we can today. And for those that we don't get the chance to answer live, we'll work with our colleagues in Guinea to return answers to you shortly. Amadou, this first question is for you. I'm seeing a lot of questions around the sustainability of these water sources. Could you perhaps explain the lifespan of each? And if you can, maybe take it back to explain why Guinea is oftentimes referred to as the water tank of Africa.
Okay, thank you very much, Missy, for the question. Actually, Guinea is called the water tower of West Africa because all the big rivers from West Africa originate in Guinea. You have River Niger, 4,200 kilometers, crossing Guinea, Mali, Niger, Nigeria. You have Senegal, Fleuve Senegal, starting in Guinea, crossing Mali, going to Senegal, between Senegal and Mauritania. You also have a River Mano, just to cite 3 big rivers, okay? And beside that, you have rivers like Konkure. I'm just stopping there. Beside that, the rainfall in Guinea is huge. For somebody coming from the Sahel like me, it's very, very impressive. I mean, you have like 2,000 milliliters of rainfall per year in Conakry. Just to tell you that the groundwater is constantly recharged. So that's why Guinea is really called the Tower of West Africa. But having said that, it doesn't mean that Guinean has safe water. It's something else different, completely different, okay? So yes, Guinea is the Tower of West Africa. The potential for sustainability because of the recharge, the continuous cycle is huge, but we still have the challenge to go and get this water where it is, to capture it, and to make it safe and make it available to everybody. That is the challenge. That's why Guinea water is very, very, very critical. Thank you.
Thank you, Amadou. Pierre, this next question is for you. It seems like a lot of the challenges outlined around education, water sanitation, link back to poverty in Guinea. Does UNICEF work to reduce child poverty through cash assistance programs or government advocacy? Pierre, I think you're muted.
That's a very pertinent remark, Missy. Thank you very much to whoever asked this question. Poverty, as I said earlier in my opening speech, is very prevalent in Guinea. 40% of the household in rural area, it's around 70%. We at UNICEF have a social protection program. The government also have a large, very large social protection program. They have an almost semi-autonomous agency managing that large program, but the coverage is still very low. The targeting is not that great. Within UNICEF, our social protection program is only running this scholarship program thanks to a generous donor. And what we are hoping, if we get more donors to provide funding for the social protection program, is to expand the scholarship program and also to pilot some feasible cash transfers program. These programs are very important because in rural areas, some girls, some boys drop out of school because the parents just can't afford it. It's about poverty at the end of the day. So I think those are the two large programs that exist from the government side. They have a lot of funding. We have been talking to them. In fact, when they were opening their agency, they only invited UNICEF and UNDP because they see the potential for working with us around that program. But it is just at the beginning.
Thank you. Ephraim, did you want to chime in with anything specific to the education program?
Hello, yes, thank you. As started by Pierre already, we have more than 40% of children who are out of school. And this is really a major concern for the government and for UNICEF in Guinea. And this program is helping the government, the communities to keep their children at school. And we think if it can be, if we can have more donors, as said by Pierre already, it will help community to keep their children at school, more children, and to reduce the number for out of school. And also to help them not only to remain at school, but also to succeed, to have good learning outcomes because of the scholarship received. Thank you.
Can you clarify for us the cost of sponsoring one student and how many students are currently reached under this program?
Can you repeat the question, please?
Yes, can you clarify how much it costs to sponsor one child for a scholarship and how many students are currently being reached under this program?
Okay, each student receives $125 per year, covering 60% of estimated expenses. And so far, the program is helping us cover 1,000 students, including 45% who are girls. Yeah.
Thank you. Now I have a question going back to Pierre, but then perhaps Amadou, you could chime in through a specific WASH perspective. Questions around how we're responding to both the COVID response and the Ebola response currently, and how these have been impacted by our programs that are currently undergoing.
Right. Thank you very much. The coronavirus pandemic was declared in Guinea in March, 12th of March 2020. And a couple of weeks later, most of the primary schools were closed. So we worked with the Ministry of Education to submit to the Global Program for Global Partnership for Education, the GPE, a large grant of $7 million to make sure that children go back to school, and there are all the measures put in place for children to continue learning. That grant, we got it last year, and most of the response of a large part of the response of the Ministry of Education was through that grant. School reopened, kids went back to school. Most teachers were trained on how to prevent what is coronavirus and how to prevent it. Mobile washing devices were put in school. We produce a lot of masks using women's group in urban and rural areas to produce masks for all children in the country. That was really a big success. But still, there were some gaps, of course, in terms of health facility attendance, for instance. We worked a lot with the Ministry of Health to make sure that children are still vaccinated. There is continuity of service. When children are sick, we work on a national campaign to educate mothers that they should still go to the health facility. They are worse, they are better off going to the health facility than not going there. Because everybody here, we have the data from survey showing that families were afraid of going to the health facilities because of that. In the area of water, I will let Hamidou talk about that, but we worked a lot with the World Bank to make sure that water was provided, especially in treatment centers, in health facilities, in schools. We got some grants from the World Bank to work on that. I think Hamidou is still working on some of the grants from the World Bank that address also Ebola. When Ebola hit Zerekore, the region of Zerekore, I think the next day we were on the road, on the bumpy road going there. And we were able to drill 4 boreholes for the communities where the epicenter is to make sure that water is available. Because when water is not available, there is no way you can educate communities to wash their hands because they don't have the water. So that was quite an immediate response, but Hamidou can also talk about our response in health facility, prevention and control of infection in health facilities. We have been very active in that. Hamidou?
Maybe can I just compliment a little bit what Pierre was saying, because really Pierre went through the whole spectrum of the system. I just want to come back to the Water for Guinea program specifically. In fact, the challenge with COVID-19 was that the team in charge of doing solar power systems were based in Conakry, and it was very, very challenging for them to leave Conakry and go to the field. On the contrary, the manual drilling proved to be very, very efficient, even in COVID context. For example, this year, we were able to drill 46 manual boreholes within COVID context. Why? Because the small enterprises were at the local level, they were in Zerekore, so they can go to the villages and they can still drill. Again, on top of getting easy, it's really light material that people can transport and go to the villages and get the water. So again, another good advantage of the techniques as such, which is really resilient to this type of conditions. You know, that's what I wanted to add on what Pierre was saying. Yeah. Maybe I can just build on I see 2 small questions coming on water committees. Is it okay, Missy? I can
please do.
Dive in.
Yeah.
Okay. Yes, water committees actually are selected by communities themselves. It's really up to the community, first of all, to identify trustworthy people who are volunteers, people who are staying in the community, and people who are not traveling, you know, I mean, living in the community for 3-4 months, you know. You really need to get all this criteria to select people. That's one aspect of it. The second aspect is that you have a gender balance. Out of 5 committee members, we are really striving to get 3 women, you know. When we have a lot of resistance, we can get at least 2 women on the committee out of 5, you see. And another issue also is that youth. We always manage to get 1 young person in the committee because it's very, very important. Young people, they are the ones who are really helping to do the social mobilization, to make sure that the maintenance system is going to work, to make people aware that they should pay for water, to make sure that the maintenance is continuing. So yes, youth are really central to the process. Youth and women's group are really the core, I would say, of these water committees. Yeah, that's what I wanted to add. Thank you, Missy. So we can, let's see if there are other questions.
Yes, thank you, Hamidou. I have another around the WASH programming, but perhaps I'll ask Pierre to answer because it's a broader question about how UNICEF Guinea works. How has the UNICEF Guinea team engaged and strengthened the role of civil society or civil society organizations in their programming? For example, Rotary. What role do they see these groups taking to improve the programming that they have already been doing and sustainably?
Thank you very much, Missy. In fact, the UNICEF country program in Guinea, along with two other UN agencies, did some pioneering work in terms of working with civil society organization, working with local NGOs, women's group, etc. And we have what we call now the UNPP platform. It's a United Nations Partnership platform, where we have all the civil society organizations and local NGOs who want to partner with the UN or with UNICEF to register themselves, describing who they are and what are their work. And we have that database where we have, in fact, a good mapping of which kind of organization are present in Guinea. And we usually work with them in terms of not only capacity building, knowing how to work with the UN, but also ensuring that when there is work to do, we know to whom we should go to partner to do that work. This is very important because we talk a lot about localization in the UN and in the international development, but we have to put it at work. This is very important, especially when a crisis hit. If you look at Ebola, when Ebola hit, one of the first NGO to be present in the field were Guineans NGO. We work with one NGO which is called Tinkiso to do some of the drilling of water points. We work with other NGOs in other areas of the response in terms of community engagement, communication, etc. So we really think that is the way to work. It's to make sure that the capacity exists, and when the capacity doesn't exist, we also work to strengthen it and to continue to work with local resources and of course with international resources also.
That's great.
Yeah.
Thank you, Pierre. And that really gets at the heart of Water for Guinea. So thank you for sharing that. I think we unfortunately only have time for one final question, and this is going to go to Ephraim. Where are the children with disabilities, and how do you make accommodations for them to be a part of the UNICEF scholarship program?
Thank you, Missy. Yes, of course, this is one of our, is a major concern for this program. And so far we don't have a list, a precise list of children living with disability. But we are working on a database that will help identify all kinds of disabilities. So that database will be is being set up and it will be operational, I think, in one month, and it will help us collect information on children. So now we know that we have some children who are benefiting from this scholarship and who have a disability, but we have so far identified 11 children with disability, living with disability. And of course, we don't have much students also who are with disability who are in schools. This is also another problem we have. But as I said, we have, I think, 11 children with disability who are already benefiting from this scholarship.
Thank you. And now that we only have a few minutes left, I would love to turn to you, Pierre, and ask if you could share a little bit about how you've seen firsthand both of these programs, the scholarship program and Water for Guinea, impact families and children in Guinea.
Thank you very much, Missy. I must say I have, as a UNICEF representative in Guinea, I have been lucky to be very, very close to the field. I go to the field every quarter, and I usually visit most of the areas where we work with the government. I have gone in very far away villages where they have never seen potable water. They have been drinking water from the rivers for generations. And the Water for Guinea program has brought clean water to these communities. And I have talked to them. And I'm not the first one. Many people have gone to the field and talked to these communities where they tell you, we can see the impact on our children, them having less diarrhea, less falling sick, less frequently because of clean water. It is there. Women have told us in the field that because of this borehole, they don't have to wake up at 5 a.m. and walk 10 kilometers to go and get water from the river. The impact is huge. There is no doubt about it. And the issue is this needs to be scaled up because we are still reaching some communities and we are not reaching others. This is extremely important that Water for Guinea becomes water for all Guineans. That is really, truly what the direction for this program. The scholarship program, the coverage is not huge, but I can tell you it is making huge differences. I have gone in rural areas where I have met this little girl who the teacher told me that she was to be married last year. But because the mom had that small scholarship, the child has that scholarship, it gave also power to her mom to say that she's not going to get married, she's going to school. So these are just two examples to tell you that these are making huge differences, and they're also giving us hope for the future, that we can make a difference. And if we can scale up that difference, well-being of children will be great. The future will be bright for children in Guinea. Thank you, Missy. And I would like really to also thank everybody who is around the table.
Thank you, Pierre. What a beautiful note to end on. And as I mentioned before, we will work with our UNICEF colleagues to get answers to all the outstanding questions. I'm sorry if we didn't get a chance to address yours live today. I want to take a moment to thank Andy Astrachan and Wendy Serino and the numerous other Water for Guinea champions on the line for partnering with UNICEF to deliver these results. I encourage everyone to go to waterforguinea.org to keep up to date on the progress we're making together, especially as we close in on our funding gap. And I'd like to extend our gratitude to the Catalyst Foundation for Universal Education for allowing kids like Fatimata to continue their education. As we heard about the multiple crises facing families today in Guinea, your collective investments and support are having a transformational impact. To our colleagues in Guinea, Pierre, Amadou, Ephraim, Fatou, and to all those who helped to host this virtual field visit, thank you. We wish you luck and good health. Lastly, for those of you who traveled with us, please stay on the line for a few extra moments as we will have a survey for you to fill out as we always continue to improve on these experiences. Once again, thank you for being a part of UNICEF's mission. Take care.